On September 2021 in Sofia, Bulgaria, took place a conference entitled Policymakers and Patients Creating the Change. For the first time, a conference addressed the challenge of health inequalities in the southeastern region, from the specific perspective of European and national policymakers, as well as patients from the 13 European Union countries, of which 12 new member states, alongside 3 candidate countries. Representatives of 7 ministries of health contributed to the successful development of the discussion sessions. The event was initiated and organized by the Bulgarian National Patients Organization with the collaboration of the European Patients Forum and under the patronage of Mrs. Desislava Atanasova, Minister of Health of Bulgaria, and Dr. Andrei Kovachev, Member of the European Parliament. The opening session was followed by the screening of a video which outlined common weak points in the healthcare systems in the new European Union member states. The organizers invited the stakeholders in the conference to present key messages on health inequalities during a discussion panel.
Проблемът е ясен. Ние сме заедно в Европа не само на инфраструктурата, която е пътна или каквато и да било друга, научна, но и на здравната инфраструктура и по най-добрия начин трябва да намериме това сътрудничество между европейска, национална и регионална администрация и политики, за да можем да се възползваме от солидарността на Европейският съюз.
Властяването на пациентите в момента в стратегията на Световната здравна организация Здраве 2020, както и последното председателство на Европейската комисия Дания, беше поставен основен акцент на овластяването на пациентите да бъдат в центъра на своето лечение, да използват най-новите технологии и да се фокусират най-вече на превенцията. Втората реакция е като председател на надзорния съвет на здравноосигурителната каса, увеличаването и използването по-ефективно на финансирането на здравната система.
Ние обаче трябва да поставим на дебат именно това, доколко пациентите, които следва да получават максимална голяма грижа, максимално голяма ефективност и достатъчно качествени медицински услуги, могат да го направят в нашите държави членки.
More that can be done to tackle inequalities in relation to things which are perhaps easier and less costly in relation to prevention, and in things like screening, vaccination, promotion of healthy lifestyles, primary care, which perhaps with, again, a debate on how better to organise that to get some things which are relatively straightforward available to everybody who needs it would be fruitful.
Nejednakost u zdravlju je jedan veliki problem. On se neće tako lako riješiti kao što nije rješiv u cijelom svijetu, neće biti rješiv ni u mojoj domovini u Hrvatskoj. No, mi smo u našem Ministarstvu zdravlja ove godine uveli čitav niz novina upravo u odnosu prema udrugama pacijenata. Udruge pacijenata imaju mogućnost svake srijede doći u Ministarstvo zdravlja sa određenom temom, raspraviti sve njihove probleme upravo kada su u pitanju liječenje, kada su u pitanju...
When we work on the solutions, it's a message to all stakeholders. We don't have to ask the questions, shall we involve patients? We passed that stage long time ago. Now we have to concentrate how effectively we can contribute to that from all sides.
Аз смятам, че сама по себе си тази конференция е началото, но следва този дебат да бъде поставен на ниво министри на държавите членки в Европейския съюз, защото за нас е много важна темата не само за разходи и ефективност на здравеопазването. За нас е много важна темата за това, кой предоставя медицинските услуги.
We will be really delighted if you can commit to help us organizing this meeting and spreading the outcomes of the conference to your colleagues in the European Parliament. It's the same with our minister. We think that it will be extremely important that ministers of health talk to each other and Ministers of Health try to collaborate between each other, and we will be delighted to facilitate also such kind of ministers meeting if you're happy to organize at ministry level. That was so kind from the European Patient Forum. So many people here, thanks from other things developed.
The second day of the conference started with the presentation of Dr. Antonia Parvanova, member of the European Parliament. The European Parliament considers health inequalities a central challenge, and Dr. Parvanova stressed the member states can benefit from wise utilization of the resources under the new financial framework of the European Union, which allows for multidimensional health reforms.
There is a lot to do, of course, and health inequalities is an issue that because of the reports of the Commission and the analysis made done, because of the information that we got from patients' organizations, the Parliament get very sensitive to this issue. And in March 2011, we produced a report, and we would like to use this report for governing and supporting further strategic framework and priorities for not only for the member states but also for the work of the Parliament. I should say it's absolutely crucial time for all of us, not only at national but also at European level, to put forward our ideas, because it's the time when the Commission is discussing and putting forward for discussion to the Parliament, to the Council, the common strategic framework. When I was presenting all the priorities, in many of them, capacity building and the opportunity for the administration to react and to correspond to this new change is crucially important, it's mentioned. That's why I should say that if it is priority for the government, not only in this area, in all areas, then our ministers and their cabinet should be in a very close cooperation with the Commission.
Followed 3 workshop groups where delegates discussed challenges patients are facing with respect to the healthcare system in their countries. The discussions were based on the preliminary interviews with 14 leaders of patients' organizations from 12 countries. In the first workshop, the delegates discussed how European Union strategies can meet patients' needs and priorities for tackling health inequalities. In the second workshop were discussed different action policy makers and institutions can take to curb health inequalities in the new European Union member states in the next 5 years. In the third workshop were proposed future steps patients should take to alleviate health inequalities in the new European Union member states. The Bulgarian National Patients Organization and the European Patients Forum will continue to support the fight against health inequalities with an in-depth survey among patients' organizations to ensure up-to-date and concrete data on the results for patients. The adoption of a resolution by the participants concluded the first conference on health inequalities in the new European Union member states. The document recalls the importance of health inequalities as a main political priority. The reduction of health inequalities forms a major pillar of the European Union health strategy, Together for Health, and a major element in achieving the goal of inclusive growth of the Europe 2020 strategy.
We have great discussions with you. We have many ideas and scenarios to how to move forward from now on, and I think this is quite a lot for all of us to think, and very good starting point. Thank you, everyone.
Thank you.
And wish you good way back. Yeah.